As we heard earlier, the military offensive by the U.S. and Israel in Iran is starting to create a humanitarian crisis. The war has now frozen the world's largest humanitarian supply hub, which is located in Dubai. To help us better understand the aid needed in the Middle East, we're joined now by Amanda Munoz de Toro. She is a humanitarian emergency advisor at World Vision, and she joins us from Nicosia in Cyprus. And appreciate, Amanda, you being there. Thank you.
Thank you for having me.
Can you talk to us about what the last few days have been like? What are you seeing?
We are heartbroken and terrified at the increase of violence that we are witnessing. We are very, very concerned about the children and their families who once again need to suffer the consequences of war and displacement. Half of the children in the region are already living in situations of conflict, and now they're facing trauma, harm, even death again. In the last hours, we are up to 97,000 people displaced, living in shelters. This is not counting the people that are still on the streets, the people that are fleeing the south, the people that are fleeing the neighborhoods that have been forcibly evacuated from south of Beirut. And we are very, very concerned about the consequences of this displacement.
And we know there have been so many people displaced. Can you expect the need for aid to grow?
Absolutely. So in the 2024 escalations, there were up to 1 million people displaced. So given the forced evacuation notices that we have seen today of the south of the country, where there's 250,000 plus residents, and now 4 of the biggest neighborhoods in Beirut, we can expect this number to grow. And actually, it is growing as we speak by the second.
At this time, what kind of aid are people needing the most?
Well, everything. First and foremost, basic needs. So we have already from the early hours of Monday morning started distributing food, hot meals and ready-to-eat meals, mattresses, blankets, warm clothes. People are going to need water. Shelters are at capacity, so people are going to be sleeping on the streets, in their cars. They're going to need access to hygiene kits. And in the south, there's still no access for humanitarians, and these people are going to be needing absolutely everything. And as hospitals close, we're going to have need for medical support. And for us, our priority is also mental health and psychosocial support for children. This new displacement is coming on top of a lot of compound vulnerabilities, and children have yet to heal from the previous escalations of conflict they have suffered in Lebanon.
And when you are helping people, what are they saying to you?
People are horrified. They're heartbroken. They're scared. Children should not have to live with this uncertainty and this fear. Children should be in school. They should be playing. They should not be hearing bombs and hiding and screaming at this horror.
And looking ahead, if this situation continues, how dire do you think it could become?
As we are seeing the situation develop, what we're seeing is an increasing hostilities, deterioration of the situation, schools, hospitals, civilians that are being attacked. And we have seen that there's an increase in people fleeing to Syria. There's an increase in internally displaced. And we're also prepared for the potential situation of Iranians fleeing for safety in neighboring countries.
And then, Amanda, I know this is a little bit outside of your work, but you're there. A British base was hit by Iranian drones. What kind of impact has that had? Do you know anything about that, or have you seen the impact of that?
We're seeing the same that is being shared in the news. At this point, it's just very scary to see how this is expanding at this rate. And we really call on everyone involved to ask for peace measures and compliance with international law.
Amanda, thank you. That was World Vision's Amanda Munoz de Toro. Thank you.
Thanks to you.